Hello, Dr. Toney Rehab. If you're watching this video, you're watching the proper use of the curve. This is the curve. The curve is designed to restore the normal lordotic curvature that you should have in the cervical part of your spine. What does all that mean? What that means is a lot of people have a very straight neck. The neck is straight, so you get that straightening of the neck. The neck should have a curve. When you have straightening of a neck, you increase degenerative disc disease and osteoarthritis. Not good. So you need a normal curvature in the neck. The way we restore that is primarily by correcting the structure. But we also gave you the curve. If in fact you're watching this video, you have the curve. So this is some pointers on how to use the curve. The curve has 3 different levels to it. 1, 2, and 3. This is considered the 3rd level on top. You start off on the 1st level here. You work your way up to the 2nd and then finally the 3rd. What you want to do when you go on the curve is you want to stay on the curve up to 20 minutes. You don't need to ever go past 20 minutes. Up to 20 minutes. So initially when you get on the curve, you're talking maybe a few minutes at a time, depending upon your neck and the condition it's in. That is okay if it's just a couple of minutes. Eventually you're going to build up, build up, build up, build up. When you can go approximately 3 times a day on level 20, for 20 minutes on level 1, that's when you need to move to level 2. When you go to level 2, you may have only to do a few minutes. That's okay. Keep doing a few minutes multiple times a day till you work up to 20. Once you get up to 20, 3 times a day comfortably on level 2, then you go to level 3. 3 is your most aggressive here. I'm going to show you what to do or how to get on the curve and how it works. Now, a few pointers about the curve. If you're on the curve and you experience dizziness or lightheadedness when you're on the curve, get off it and talk to me before you do it again. In addition, if you first get off the curve and you experience a slight episode of dizziness when you first get off the curve, that's normal for that to take place. If it lasts 30, 60 seconds at the most. If it goes beyond 60 seconds, don't use it again until you talk to me. But that's normal when you first get off the curve. When you're laying on a curve, you should not experience dizziness. In addition, if you experience any numbness, tingling, going down the arms, if you have any of that take place while you're using a curve, don't use it anymore. If you get a numbness, tingling area where your neck is laying on the pad, that's normal for that to take place. You're putting more pressure on that area than what it should be there. So don't worry about that. Let me show you how the curve works. You're going to lay on the curve with this side of it right here being in the back, and you'll see what I'm talking about. I'm going to lay it down like right here so you can see it. When you lay down on the curve, make sure you're putting your knees up on a pillow. You want the arch of your back taken out. So here's what it should look like. I have my knees up on a pillow or my feet flat on the table. I'm going to position the curve in such a way that it's down in as far down my neck as it can be. If I have it like here, it's not doing any good. It's just basically a pillow. If it's here, it's not doing any good. It has to be down here, allowing my head to rock back over the device. So notice the position of my face is this way. That is proper. I then take the strap and I put the strap on. Now you don't have to use the strap initially, but eventually as you do this more and more, you should use the strap because it gives you more of an extension on your head. And then basically I just lay here. I lay here for 20 minutes and think about all the things I need to be doing. People complain about laying for 20 minutes. This is the most important 20 minutes of your day in some cases. You've got to stop the degeneration, the osteoarthritis in the neck. And the way you do that is stretching passively the anterior ligaments or the front ligaments of the spine itself. So if I need to get off, I hit these buttons here, right there, and I pull that strap off, and then I bring myself off the curve. I could turn to the side, I could lift my head up, whichever way I need to do it, and I bring myself up off the curve, and that is it. That is the use of the curve. Any questions on that? Ask myself, ask Janet. It's pretty self-explanatory. Couple important things. One is make sure it's down far. You want it down far so that the head is back over it. 2, make sure your feet are either flat on the floor or they're up on a pillow, creating a 90-degree angle between your abdomen and your thighs and your calves. Any questions? Ask us. All right, Dr. Toney Rehab, I'm sure you'll be seeing me again. Goodbye.